the globalization skeptics they would insist that, nation states and imagination of border territoriality per se and sentiments of nationalism are only proliferated and intensified along with the global flows of people and things. Now, as much debated this subject is, it is also hard to deny today that despite all the movements, migration, and mobility across borders, the significance of borders is far from over. The coronavirus pandemic, in fact, has proved that once again that walls do matter. And there is a very intricate and very intimate relationship between how nationalism as a sentiment navigates across border within the diaspora and how that informs both our COVID specific and post-COVID experiences. Now, to discuss more on this relationship, we are really excited to welcome Professor Peter van der Veer, who is the director of Planck Institute for the Study of Religious and Ethnic Diversity, Göttingen, and also a very established name in the fields of migration, nationalism, interface. So in today's session, that is the 7th session of Corona Conversations, Mobility in a Post-COVID Future, Professor van der Veer and I will be conversing on the rise of nationalism and its effects on the diasporic communities in a post-COVID world. So thank you so much, Professor van der Veer, and it is truly a pleasure to have you among us today. Thank you so much for joining us. And I'm really looking forward to the conversation, and I'm sure all our participants are very much looking forward too. So before we formally begin, just a couple of things regarding the session today, which I mostly reiterate before every session. So today's session is split between a conversation followed by an open house, where the participants are invited to pose their questions and share their comments with Professor van der Veer. And the conversation will be of around 30 to 35 minutes. And the open house will be for about 20 minutes. And so the entire session is going to be around, say, 55 to roughly an hour. Now, the conversation between Professor van der Veer and I will be recorded. And all the other recordings of the previous sessions are already available on the GSSC website. So I would request the participants not to record or take pictures of any portion of the session, because all of them will be available later for future references. And regarding interacting with Professor van der Veer in the open house, you may please raise your hand button on Zoom and introduce yourself briefly and ask the question or share your comments. But in case of a technical problem because of which you are unable to do so, please put your questions in the chat box, and any of us will, Martina, Ulrike, or Anna, or any of us will take them up. Now, this is largely the structural specifics regarding the session, and let us now begin with the conversation. So Professor van der Veer, the coronavirus pandemic has arrived at a time when several nations are witnessing rising populism, coupled with strong right-wing politics around that. Now, while this helps consolidate the diasporic networks, one of the major outcomes, at least as what we have been witnessing in a pre-COVID world, is that the populist governments push liberals and critical thinkers out of the political space, to the extent that many end up in jail, and several others are forced to seek asylum status in countries that may allow them greater freedom of speech and expression. Now, put within the context of the pandemic, how far is it instrumental in informing the politics of hate and communalism within the diaspora? For example, let's consider the countries in South Asia like India. On one hand, we witness the engineers, the students emigrating from India to the UK, USA, Germany, Canada, and so on. But coming back to the question of populism, the rise of the right and the consequent hate mongering, we also witness a lot of people leaving the country and seeking refuge in countries in the West in search of fair democratic and fairer human rights. Now, so there is a clear segregation within the diaspora, at least from what I have been observing among the Indian diaspora in Germany till now. that those who migrate, for example, the blue card holders, and those who migrate, for example, within the scholars at risk framework or academia in exile program, or the for seeking refugee status, so there's a clear segregation within the diaspora. So from that perspective, what is the role of hate in the diaspora, especially during a pandemic, when anti-migrant sentiments are already expected to increase in the host societies?
Yeah, thank you. I think there are a number of issues here. First, what you mentioned, the rise of populism, which is a global phenomenon. It's not only in Germany or France, England, but also in India and in China and all other places. And we can only say that this virus has enhanced anxieties and sentiments that are part of populism. The other aspect of it is obviously the rise and development of social media. So people get particular information about the world through rather limited channels of their own choosing, as it were, but basically chosen by the algorithms. So the virus and the anxieties that it creates just feed into what was already rather strongly developing. So, for example, in India, you have with the BJP government a rather anti-Muslim policy and a populism that basically blames the Muslims for all kinds of things. And obviously, that also feeds into the virus anxieties, and then the pandemic is blamed on transnational networks of Muslim tablighis who indeed have international networks, live in various places, have their big gatherings, their ijtima in different places having international participants. So blaming them for spreading the virus is a common strategy. In the beginning of the virus anxieties, it were the Chinese, of course, who were object of this particular idea, and Chinese restaurant had to close, and the Chinese migrants were seen as spreading what President Trump or ex-President Trump called the China virus. So the idea that migrants spread this stuff has been always the case with any pandemic disease. And the blame game is a very common element of any form of populism. So I do think that the virus has exacerbated this situation, but not really produced it or created it. The other thing, what you were saying, is about the differences in the diasporic community. People who flee places because of their criticism on policies, like, of course, we have seen in China dissidents being put on under pressure, or people who were just recording what was happening in places like Wuhan are put in prison. So that definitely has happened. But in general, I would be very careful of thinking of the diaspora, of any diaspora, as of one cloth. People are actually extremely different. And in many cases, class differences are more important than ethnic differences. So people of upper classes who are, of course, transnationally mobile, have, of course, suffered from this virus, but significantly less than lower classes, people who who have to do gig work, people who have to bring food around, and so on and so forth. These are mostly, again, poor migrants, but they are very different from, say, the IT engineers and so on.
Right. So what you, as you're saying, the blame game, and which also like is exemplified by the entire populist idea. What I understand is this entire blame game is also closely linked to the subject of territoriality, and I would like to just get into that aspect now. The pandemic has forced return migration on one hand, and halted the overall migration mobility situation on the other. Now, at some level, also Nina Glickschiller and several other people are, Xiang Biao, these people are also writing about how migration has facilitated, new migration has been facilitated because of the, because of the coronavirus pandemic. So there are all sorts of things going on around migration amidst COVID-19. Now, at this point, I'm reminded of your seminal work on migration and nationalism, where you maintain that migration and eventual diasporic networks, in fact, they invoke nationalism, contrary to the popular belief that, when people disperse and their in sentiments of identification become fragmented as well. Now, sticking to that argument that migration and diasporic networks also invoke nationalism, that where do you locate territoriality as a defining premise for negotiating with a contagion like coronavirus? And what impact does it possibly have on nationalism as sentiments and also as political action?
Yes, I think the main thing, the first thing to argue is that territoriality has been central to a response to the pandemic. So you have a global phenomenon which basically affects everyone, and the responses have been even for me, amazingly nationalist. The European Union, for example, in the beginning of responding to the spread of the virus, was not a European Union anymore. It was a German response, a Dutch, a French, and so on and so forth. So the national response, the national territorial response by closing the borders, is striking, even for a transnational unity like the European Union. And this we see also continued with the vaccine, who is going to have it, and so on. So I think the basis of this is the tax system and the health system. They are connected to the territorial state. And so people in Germany pay for German health, and therefore for the German response to a pandemic. And the government is being either blamed or praised for its response, and that will also turn out to be important for the elections. So that's in a way a continuation of the old situation, that globalization does not do away with the nation state. It is always in a dialectic with the nation state. Now, diasporas, transnational networks, of course, are cross-cutting. They connect people over these borders, and they are directly affected by this because of the immobilization of people.
Right.
To some extent, of course, you can say, well, this also creates new migrations. Well, it exacerbated the already existing inequalities in the world. And inequality is one of the major forces behind, or structural elements behind people's migration. People just would not go, as it were, if everything was great in the place where they live. So
Right.
this COVID or this pandemic will just exacerbate this, but this is a more general pattern.
All right. So, talking about territoriality, um, as we understand that territoriality is not just restricted to how we address the migrant situation, but also, in fact, when we are dealing with the question of virus and the vaccine. Now, why I say so? Because both the virus and the vaccine have very strong implications of nationalism. Also, as I understand, for example, the recent debate has been that if the UK strain is worse than the strain found in South Africa. Now, this kind of arguments kind of makes us wonder to grapple with these ideas of virus nationalism and vaccine nationalism, as two binaries. Now, so within that context, put in that context, the concern here is again how far this entire discourse of vaccine nationalism and virus nationalism going to inform migration and mobility in a post-COVID situation in general. What's your take on that?
Yeah, I think what one has to see is that healthcare systems are very different all over the world, and that therefore the responses to a pandemic are very different. We actually don't know how, for example, in India, healthcare responds to the virus for large parts of the rural population. We only have seen that with lockdowns, people have been chased back to their home villages, and what happens in these home villages is unclear. I can, as a methodological point, I can say as an anthropologist that we also cannot know anything because we are ourselves not mobile. We cannot do the research that is necessary to find out how these healthcare systems reach people and what kind of choices there are made in responding to this crisis. All that, in my guess, will just be shown later when some death statistics become available. But as you know, statistics also only tell us part of the picture. And in many places, they are not very well collected. And what one has to also look at is the collateral damage, as it were. People dying from hunger or from other diseases because of being pushed aside. Now, so that I think is an important issue, the differences and the inequalities in the world's healthcare systems. But I think also it's interesting to see to look at the geopolitics of pharmaceutical companies and how that is related to partly nationalism. We have a Russian vaccine and we have a Chinese vaccine, and we have kind of a praise of Turkish people of Turkish origin who work in Germany, creating a vaccine. I mean, this is all kind of peculiar, connected to the ability of a nation to respond to this pandemic. And so it reinforces the idea of nationalism and reinforces also geopolitics. And the real question is how are these vaccines being distributed over populations, and who has access to them? So you can have a situation in which, say, people are vaccinated in say Germany, and then of course create antibodies in their body, and are not allowed anymore in China because they have another vaccine there and do not accept the vaccine that comes from Europe. So you can see how that immediately affects mobility also.
Right, right, absolutely. So the geopolitics of pharmaceuticals, that's something very interesting that you mentioned. I'll come back to it a little later. As of now, caught between the vaccine and the virus nationalism that we are talking about, how, in your opinion, the COVID-19 is going to kind of change or impact the way migrants identify with the entire idea of homeland? In the host society, especially those belonging to multi-generational families in the home country. This is my concern right now.
Yeah, I think what I find that personally the most striking aspect of this pandemic is death, and the connection of people to the death of their relatives. And this is already in non-mobile situations the case, that people can not attend funerals or are limited in their attending funerals and so on. But this is, of course, enormously worse for diasporic communities whose, when you have parents living in India or in China, or elderly you cannot actually reach, and you can only hear. Well, the fortunate thing is that we do have Zoom and so on, but mostly actually only hear what happens to them, and you cannot be part of their dying, which I think is a major aspect of our social life.
Right.
Now, I think so. I think this affects people who are not mobile, but it affects people who are very mobile and are living in these transnational networks much more, and will make them think more, I think, about the possibilities of a cosmopolitan life. What seemed to be very possible, that you would just jump on a plane and help your parents through a difficult patch, that is just not feasible. And so I think one of the aspects of this situation is death and mourning being organized in a very difficult way for people who live in transnational networks.
Right. So death and mourning, and as you very aptly point out, that like the impossibility of reaching out to your families in the time of need, and that immobility has been a bane and a boon both during the pandemic. Uh, I'm just kind of reminded, and I'm inquisitive to ask you this question, that we also had a similar pandemic 100 years ago, like the Spanish flu. And that was a time also, like it was just after it was a post-war period, and nation building, nationalism, sentiments of nationalism were growing. And so I mean, it is comparable in some way or the other with the situation today in the context of populism and right-wing nationalism. So, but do you compare this to pandemics in the light of nationalism and immigration in any way, or you think like they were like really discrete in terms of situations?
Yeah, I think people at the beginning of the 20th century were much more aware of the possibility of being killed by epidemics. And there was polio, there was smallpox, there were in many places in the world malaria, and there were places where you could not go because of the disease situation. So I think the awareness of this has decreased. That's why people are also, I think, so taken aback by this. This has been around for forever. And I think the only big difference is our medical capabilities. What we can do now in terms of respirators and so on was not even possible 20 years ago. I read an article recently in which the author shows that 5 recent that means in the last 20 years, 5 recent Nobel Prizes were necessary for the development of our response. With that capability also, this whole idea that we can handle this, in another context we would say, wir machen das, that whole idea is a new idea. And the idea that nobody should die is also actually very strange idea. And it has to do with this growth of capabilities and the enormous investments that are made in some societies in the medical system. That I think is a clear difference with the 1918 so-called Spanish flu that was also quickly spread all over the world, in which India was also terribly affected. Mm-hmm. And the only thing you can say is that some healthcare systems have more promise, have more promised, and therefore are more taken into account than other systems. People have been in many places in the world just be very experienced, you may say, of dying and of not getting any health care. This is not the case in modern Western Europe, but it is definitely the case even in the United States, in areas of the United States, and certainly in large parts of Asia, Africa, and Latin America. So, yeah, I think the question has to be seen in terms of the development of these medical capability and then the enormous inequalities between nations in providing them.
Right, differential medical capabilities and how we see, or how nations have their perspectives towards life and death and obsession with life, or at some level maybe nation building and nationalism also kind of informs in here, because obsession with youth and a youth population who can actually participate more in the process of nation building. Well, this is really interesting and very exciting and very brainstorming. But what I will do now is I'll quickly make 1 or 2 comments on the basis of what we have discussing, and then we can open the house for the participants to join in the conversation. So you said something, two very interesting points you made. You said something about how cosmopolitanism is going to be a challenge. Now, how populism, nationalism, which are often the 2 sides of the same coin, perhaps, are also going to increase and intensify anti-migrant sentiments in a post-pandemic future. While on the other hand, Nina Glickschiller and Aisha Chalar, they insist that although COVID-19 leads to dispossession for the migrants, but at the same time, urban regeneration is kind of not possible without acknowledging their indispensability. Now, whether cosmopolitanism is meant only in the context of urbanization and urban regeneration, or in other ways of reaching out to their home countries, that's another question altogether. But in view of both these possibilities, I think this space is something very interesting to watch out for, that how far does the pandemic reinforce populism guarded by cultural nationalism, and how that in turn affects and impacts the way migrants can afford to imagine a constructed homeland in the host society. Now, of course, this process is going to not be very standardized for all types of migrants. As you said, that the diaspora is not a monolithic space, but there are always variety. But from that standpoint, somewhere, diasporic nationalism as against diasporic cosmopolitanism, if we call it, could be a niche for the emerging middle class, in my understanding, because they are the biggest consumers of neoliberal services anyway. Now, closely linked to this, and from what I gather from from our conversation, the role of the big pharma that you just were talking about is something really important. As you were pointing out, that the geopolitics of pharmaceutics is a subject that will, increasingly gain prominence in reinforcing nationalistic sentiments in the diaspora. Now, there's a huge public comments already on how the Gates Foundation pushed Oxford University to deliver its COVID-19 vaccine to one of the pharmaceutical partners, AstraZeneca. And there's also going to be more and more such occurrences in where neither the nation states nor the political leaders will decide about the future of mass inoculation against the coronavirus, but the big pharmas will decide that. And so located within the broader context of nationalism as a sentiment, the very notion of what nationalism constitutes kind of is undergoing a massive change, is likely to undergo massive change in a post-COVID situation, in my understanding, because the role of the big pharma is a key factor, which wasn't so much the case before. The role of the big pharma in how we look at migrants and how we define citizenship. For example, simply, who gets priority in the inoculation process, as you were talking about, and if you get vaccinated in Europe and then you go to China and then, you're not eligible to enter the country. Now, migrants and natives, like who gets priority in the inoculation process? And this will be increasingly a complicated question. And how the big pharmas roll the vaccine out and in which part of the world, whether it's the global north or the global south. So all these are going to be deciding factors in my understanding. And so from that standpoint, it is likely that there will be new parameters for categorizing people into migrants and non-migrants, who gets acceptance and who doesn't. And that in turn, these new categories and new strands of identification may inform the way we envisage and we define nationalism, especially within the diaspora in a post-COVID future. This is what I wanted to share, and this is what I understand from our conversation. And I will stop now, and then let's open the house and let's have our listeners and participants join us in just to expand the conversation.